Okay, we'll start with the session surgical instrument. So, what is this instrument?
Langenbach.
Okay, so this instrument is called as Langenbach retractor. Okay, why you are telling this is Langenbach retractor? It is based on the parts of the instrument.
L-shaped.
Yes, L-shaped. Okay, so we'll discuss that. This is an L-shaped retractor where you can see this is the L-shaped retractor. Okay, this instrument has got some parts. This one is the handle of the instrument, and this is the shaft of the instrument, and this one is the blade of the instrument. Okay, and if you watch carefully, the angle between the blade and shaft, it is coming around 90 degrees. That is, it is perpendicular to each other. As well as from the blade, you can able to see the tip is somewhat, again, it is turned to 90 degree. Okay, so this retractor, Langenbach retractor, is L-shaped, and these are the parts of the retractor, and you can have some hole also. You can put your finger while retracting, that will give some grip to the retractor. Okay, what is the use of this retractor? Or anywhere, the retractor, it is mainly used in showing the operative field. Wherever you want to do surgery, you want a clear operative field. In that thing, you have to retract the tissues and show the operative field. So that is the ideal use of the any retractor. Here also Langenbach is also using for the same purpose only. This Langenbach retractor you can commonly use in cases of any hernia surgery or any appendectomy. So this is commonly used instrument. Okay, so we'll show that this is the use where you can see the patient is having right-sided inguinal hernia, where you can see that the two retractor. This is one retractor and here another retractor. Both of them are Langenbach retractor only, but the size varies. So it comes in different sizes. This is smaller one, and this is a somewhat bigger one. You can see the blade thickness. That is, this blade is somewhat wider, and this blade is somewhat shorter one, smaller one. Okay, so this blade, so this use of this retractor is to retract the tissues so that you can have able to see the operative field very clearly. So this is one example where you can see that it is used in hernia surgeries. Okay, we'll go to the next instrument. What is this instrument? Any guesses? So this is again, this is also a S-shaped retractor. You can see it is an S-shaped retractor. This retractor is called as czerny's retractor. Okay, czerny's retractor. Here the same, the parts are there, but you can see that this is the there are two blades are there. At one end you got a solid flat blade. A solid flat blade is there, and other end you can this blade is it is biflanged hook. Okay, biflanged hook. So this instrument, it is a S-shaped retractor. You got two blades, but you can see that both blades are opposite to each other. You can see that the blades are opposite to each other. One end you got a solid flat blade, and other end you got a biflanged hook like structures are there. Okay, so this is the, okay, you can see that the original picture of the czerny retractor. This is biflanged hook and this is a flat blade. Okay, so the both ways you can use this instrument. The uses and are similar to that of the Langenbach retractor. Okay, what is this retractor? Any idea? Manish?
Sir, I don't know, sir.
No idea. Okay. So this is again the shape. You can see that the shape. This is also L-shaped retractor. This retractor, but you see that retractor, the blades are somewhat a wider blade. Okay, this retractor is called Morris retractor. Okay, Morris retractor. You can see the blades and handle are somewhat wider when compared with the previous Langenbach retractor. Okay, so this retractor is mainly useful in cases of whenever you are doing a major surgery. Okay, major surgery where you want to retract the, for example, in abdominal surgery, like when you are doing laparotomy as well as in appendicectomy, where you will retract the abdominal wall. Okay, so the tissues are larger ones, so you have to retract the abdominal wall using this instrument, Morris retractor. It is used in thyroid surgery also for retracting the muscles like sternocleidomastoid muscle or strap muscles. So, and it is used in MRM, modified radical mastectomy. So there it is useful to retract the pectoralis major muscle to visualize the axilla properly. It is useful in herniaplasty, like inguinal hernia surgery, where you want to see the posterior wall of the inguinal canal while fixing the mesh. So there also you can use this instrument, and it is used in MR&D, that is a modified radical neck dissection, where the retractor, again, it is useful to retract the sternocleidomastoid muscle. So in so many ways, the retractor is useful, particularly in abdominal surgeries. Okay, what is this retractor?
DEAVER'S retractor.
Very good. So this is DEAVER'S retractor, and this is also S-shaped retractor. Okay, and you can see that there's a curve. You can see that a curve is there. Okay, and so this is mainly useful. What are the uses of this retractor? If you take number one, in cholecystectomy, this retractor is useful in retracting the right lobe of the liver. So whenever you are doing an open cholecystectomy, you have to retract the liver. In that case, you can use this DEAVER'S retractor. And when you are doing truncal vagotomy, you have to retract the liver, but here you have to retract the left lobe of the liver. And when you are doing gastrectomy, you have to retract the liver. So there also it is used to retract. So mainly useful to retracting the liver whenever you are doing upper abdominal surgery. And similarly in pancreatico-jejunostomy surgery, you can retract the stomach. So in pancreatic jejunal surgery, you can retract the stomach. And hemicolectomy. So you have to hemicolectomy, you have to mobilize the colon from the paracolic gutter. So there it is used to retract the abdominal wall. Then in kidney also, wherever you are doing some surgeries on kidney, there also you have to retract the abdominal wall. That is, there also it is useful. And the surgeries for rectum, carcinoma of the rectum, that is then anterior resection and abdominoperineal resection. There it is mainly useful to retract the, in case of males, it is useful to retract the urinary bladder. In case of females, it is useful to retract the uterus. Okay, so this DEAVER'S retractor, it is also coming in a different sizes, and you can use it according to the size, you can use that. Okay, so this is one example where you can able to see the DEAVER'S retractor. Okay, so this is the DEAVER'S retractor. You can able to see this is the DEAVER'S retractor. So where we are using in case of an intestinal obstruction. Okay, can you able to see this is the band causing the intestinal obstruction. Here and all you can see the small bowel, dilated small bowel. Okay, so the band was released and the obstruction was relieved. So here you can use the retractor, DEAVER'S retractor to retract the abdominal wall. Okay, what is this instrument? Okay, so this is an instrument called BP handle. That means Bott-Parker handle. Okay, this is called Bott-Parker handle, which is nothing but you have to put a surgical blade into this slot. Into this slot, you have to put a surgical blade, and that is useful for making incision. So whenever you are opening, whenever you are for any surgery, you want to make a skin incision, there you can use this surgical blade, put the surgical blade into the handle and you make an incision. And while doing flap raising also, whenever you are doing flap raising, So this blade can be used to raise the flaps as a sharp dissector. Or in some cases, you can use this to cut the pedicle. Okay. For example, in cystic duct, in open cholecystectomy, you want to cut the cystic duct. Under the instrument, so duct will be placed, and then over that you can use this blade. You can cut the cystic duct. It comes in commonly. It comes in size 3 and 4. So the size usually it will be written here. Usually it will be written here. The number 3 size handle will fit into some important blades. I will just give only one or two examples, like 11 size and 15 size blade. And the 4 size handle where the 22 size blade will fit. Okay, so this is very important. You can keep in your mind because the next thing we are going to discuss about the surgical blades. Okay, what is this one? No guesses. Okay, so this is a
22
surgical.
size.
Yeah, okay. So you can see the size, no? Here you can able to see the number, that is the 22 size. It is a surgical blade. So 22 size surgical blade, and this is the commonest blade used to make larger incision. Okay, for example, whenever you want to do on laparotomy or in modified radical mastectomy or any surgery, you want to make a bigger incision, open cholecystectomy, there and all, you will use this surgical blade, that is a 22 size blade. So you put this blade into the BP handle and try to make an incision. So how to hold the blade when you are using 22 size blade? How to hold the handle is, you have to hold like this. That is the car key holding position. Car key holding position. So you have to hold the handle like this, and you have to make an incision. So this is for the 22 blade. Here, what is this blade? This is
15.
Yeah, this is surgical blade 15 size. This blade is, what are the indications for using this blade is, whenever you want to make a smaller incisions for minor surgeries. Okay, for example, excision of the sebaceous cyst, lipoma, excision of the dermoid cyst, or you want to make as finer incisions. In that cases, you can use this. Okay, so you have to use that one. And the uses of this instrument, as like that, you have to make an incision, as well as for flap raising. You can use the flap raising, mainly for flap raising. Also a sharp dissector, you can use this blade. And here the grip of the blade, here you have to hold it like a pen holding position. Okay, as like that, you have to hold like a pen holding position to make a finer incision. Okay, this is 11 surgical
11
blade,
size.
11 size surgical blade. The main uses there and all, they are going to make an incision in the skin, but here the uses is entirely different. That is, it is useful for making an incision in incision and drainage of an abscess. It is useful to make an opening in the artery, that is arteriotomy. It is useful to make an opening in the vein, that is venotomy. Okay, because as you see this blade, it is very sharp. As like other blade, this is very sharp. You can put a stab. So using this blade, you can put a stab incision. And apart from other uses is, you can fix the, for keeping a drain, you have to put a stab incision, and you can use this 11 size blade. Okay, so for incision and drainage, there is a special method called Hilton's method of incision and drainage, which is nothing but, here you have to make an incision, only skin incision you have to make, then followed by, and that skin incision, it has to be parallel to the neurovascular structure. Suppose if you put a perpendicular to the this neurovascular structure, there is more chances to get injury. That's why you should put on skin incision parallel to the neurovascular structure. Then you have to using a sinus forceps. Okay, using a sinus forceps, and then open the cavity and then drain the pus. So this is commonly useful wherever the major vascular structures are there. For example, in case of parotid abscess, you can use or in case of an abscess in the axilla, okay, in case of an abscess in the inguinal region. Because these are some locations where you can use this Wilton's method of incision and drainage. To avoid the neurovascular structures, you have to put an incision, skin incision parallel to the neurovascular structures. What is this
So
one?
hydrocele also we can use, no sir?
One.
Surgical blade number 11.
Hydrocele, yeah. You want to open the sac, no? Sac, yeah, at that time you can use, because, but before that you have to palpate for the testis. You should make an incision that it should away from the testis. Yeah, hydrocele also you can use it. To drain the fluid, wherever you want to drain, you can use this. Okay, what is this one?
Sir, up 15 surgical blade la.
15 no சொன்னேன் 15
surgical blade.
Yeah, for excision of all the minor surgeries. Lipoma excision, sebaceous cyst excision.
அதுவும் hydrocele யூஸ் பண்ணாங்களா சார் அது 15 surgical blade?
It depends upon, if you want to make skin incision, you can use 15 blade or a 22 blade, whichever you want. If blade is not available, you have to use 15 blade, 15 size. What is this one?
Oh yes.
This is the curved scissor. Okay, this is Mayo's curved scissor. So always the curved scissor is to cut the tissues. Okay, you have to cut the tissues. Mayo's scissors. Okay, so what are the tissues you can cut? You can cut the external oblique. So aponeurosis, for example, external oblique aponeurosis in while doing inguinal hernia surgery. You can cut the peritoneum while doing laparotomy or appendicectomy. You can cut the fascia, and you can use it. These scissors can be used to dissect as a sharp dissection. While raising the flaps also, you can use these scissors to cut the tissues also. Okay, so that is a Mayo's curved scissor. This one is the same scissor, but it is a straight scissor. The uses of these straight scissor is to cut the sutures, threads. Okay, you should not use to cut the tissues, you should use to cut the sutures. After suturing, you have to cut the sutures. So using straight scissor, you can cut the sutures. Okay, so what are the sutures you are going to cut and how to cut? Suppose, for example, whenever you are putting a skin suture, you will use a non-absorbable suture material, because you are going to remove the suture after over a period you are going to remove. So when you are using non-absorbable suture material, ideally you should cut at least leave 1 centimeter. Okay, yeah, limb has to be 1 centimeter, limb has to be you have to leave. For absorbable suture material, that is inside the body you are going to, you have to cut the sutures just above the knot. Just above the knot for the absorbable suture material. Okay, for non-absorbable suture material, where you want to take out the sutures like skin suturing, there you have to cut that. You have to leave a limb of at least 1 centimeter. Okay, what is this scissors? This is also a scissor. This is called a suture removal scissor. Okay, suture removal scissor. This is called the HEATH'S suture removal scissor. So mainly used to remove the suture, particularly when you are doing skin suturing, you know, so this suture has to be removed. So how to remove and cut the suture? For example, this is the incision. This is the incision, and if you see that, okay, this is the suture. This is 2 limbs you can able to see. This dotted line is inside the wound. Okay, so what you have to do, you take one instrument and try to pull this thread. What will happen? This knot will come somewhat above. Then just below the knot, you have to cut here, not here. You should not cut here. You should cut here only. The reason is, after cutting this suture just below the knot, you have to pull the suture so that it has to come out completely. Okay, suppose just imagine that if you cut the suture here, suppose if you cut the suture here, and if you pull out, what will happen? This tissue, this part, no, this part is called exposed part of the suture. it will go inside the wound and it will come like this. So that will cause an infection to the wound. So you should know that where to cut the suture. Okay, so the unexposed part only, just below that you have to cut and you have to take the suture. Okay, so this protocol you have to follow while removing the suture. Okay, what is this instrument? So many times you have seen this instrument.
ALLIE'S tissue forceps.
Okay, so this is ALLIE'S tissue holding forceps. Okay, so you can able to see a large gap. Okay, within the blades there is a large gap is there, and if you see the tip of that, you can able to see both the sides the serrations are there. So if you lock the instrument, it will oppose to each other. Okay, so this is ALLIE'S tissue holding forceps. Within the blades there is a large gap is there, and the tip of the blade you can able to see there. One side there is a sharp tooth, the other side there is a groove is there. Okay, what are the uses? Again, it is used to hold the important structure. For example, when you are for laparotomy, you are making a skin incision. Okay, linea alba is there. Okay, so we want to open the linea alba using this ALLIE'S forceps held at two places, and then you can cut the tissues. Similarly, when you want to open the peritoneum, you hold the linea alba on both the sides using ALLIE'S forceps and cut the peritoneum. Okay, similarly in thyroid surgery also you can use this to raise the flaps, hold the flaps, skin flaps, and upper flap and lower flap you can hold with this instrument. For bladder surgeries, for example, suprapubic cystostomy or suprapubic vesicolithotomy, in that cases also you can hold the bladder. And as like that, excision of all the small surgery like lipoma excision, sebaceous cyst, and other dermoid cyst excision also you can use this instrument. Okay, so you can see that small cell serrations. Okay, serrations are there. Okay, so this is ALLIE'S tissue holding forceps, and this one is the babcock's. Yeah, babcock's tissue holding forceps. Here you can able to see here. It is a lighter instrument. This babcock's is a lighter instrument, and if you watch carefully, the tip of the blade it is curved and fenestrated. Fenestration nothing but it is an opening is there. Okay, and that in the tip of the blade you can able to see one side there will be ridge will be there, and other side it will be groove will be there. Okay, so what are the uses? The main uses are useful in holding the appendix during the appendicectomy. So you can hold one at the base of the appendix, another one at the tip of the appendix. In some cases, you can hold at the body of the appendix also. Or so the three places you can hold using this instrument. And whenever you are doing gastrectomy, you can hold the contents of the stomach and the jejunum. Okay, while doing anastomosis. You can hold the stomach and jejunum while doing gastrostomy and jejunostomy. In bladder surgeries like suprapubic cystostomy or any bladder surgeries, you can use this instrument to hold the urinary bladder. Okay, so this is the babcock's. You can see the triangular shaped fenestration is there, and here you can able to see the groove one side. Okay, this is the use of the instrument. You can see that this is an appendix, where you can see that it is the base of the appendix, it is held. Here the tip or the body of the appendix is held by another instrument. You can able to see the appendix is held with the Babcock's forceps, and this fenestration, it allows the bulging of the tissues through the opening, so that gives more grip. Okay, so this is the last instrument. What is this? Any idea?
Lane's tissue forceps.
Okay, very good. This is a Lane's tissue holding forceps, and this is a thick instrument, and it's an heavier instrument. Okay, so if you see that tip, it is curved in nature as well as fenestrated, as like Babcock's, and the tip of the instrument there will be tooth will be there, and the opposite side there will be groove will be there. Okay, so that gives a firm grip. So users, while doing parotidectomy, you can hold the parotid gland, and similarly while doing submandibular gland excision, you can hold the submandibular gland, and in mastectomy you can hold the breast. Okay, because the breast is a fatty tissue, it will slip, so you can hold this one, and you can use this instrument as like a towel clip also. because it has got a tooth to hold the drapings as well as the drain tubes, suction tubes, and all these things. You can use this instrument. Okay, so this is the Lane's tissue holding forceps. You can see that tooth is present on this side, and the fenestration, oval fenestration is there. Okay. Okay, I think that's all. So what we discussed is the I think 3 topics. One is the retractor. Okay. One is the retractor. That is 4 retractor, Langenbach retractor, then czerny retractor, then Morris retractor, then DEAVER'S retractor.
DEAVER'S.
4 retractors we have discussed, and the surgical blades and handle. Okay, that is a BP handle, 3 surgical blades, and then scissors. 3 scissors we have discussed. One is a curved scissor, another one is a straight scissor, another one is the suture cutting scissors or suture removal scissor. Then comes the tissue holding forceps, 3 tissue holding forceps. ALLIE'S tissue holding forceps, and then Babcock's tissue holding forceps, and finally Lane's tissue holding forceps. Okay.